My name is Dr. Mataria. I'm a general dentist practicing in California. I do actually have my own institution and my own dental lab. I do run a class that's called Prosthetic Consideration and Implantology. I would like to invite you for this class, and if you were to ask me why should I attend your class, I would say you would walk home with two main valuable piece of information that will change the way you practice with every case. After attending my class, you will finally understand the ideal 3D position of every implant. I had the pleasure to teach implant marathons where I taught multiple students back in the day where to place implants. However, not till recently, we were able to decide and identify the ideal 3D position of every implant. So if I were to ask you right now, if you are a practicing implantologist, how do you decide where to place the implants? Are you very confident that you are selecting the ideal 3D position? Are you very confident with your length selection, with your width selection, with your number of implants? And can you provide a final restoration that can allow the patient to function without having to brush and floss their final restoration and still be able to grow bone and tissue? This concept is called prosthetic grafting. We will understand how biomechanics plays a major role in allowing us to prosthetically graft and provide a restoration for our patient that does not require flossing. This is accomplished by real knowledge over experience or surgical skills. If you do not understand the system that you must use, if you do not understand the proper location that you must use for this case, if you do not understand how to restore it correctly, you will fail to accomplish the goal that we set for you. Again, our goal that every implant restoration should last 40 to 50 years. It should grow bone and soft tissue, and it should not fail or have any prosthetic or biological problems, and the patient should not have to maintain it or brush it or floss it. If we set this goal to ourselves, this is where we can teach you how to accomplish it within our 3-day class. Part of what we teach is teaching you how to make a custom healing abutment for every case. So you will have during the hands-on exercise the chance to place an implant in the palatal root and in the immediate area and fabricate your own custom healing abutments. Learn how to polish zirconia to provide that zero probing depth and that seal that would create biological width and allow you to grow bone. So again, what we teach is biomechanics, which is a philosophy started by Carl Mesh, and we build up on it by including the philosophies that we learned from zero bone loss, from Professor Zucchelli, from Professor Coys, from Professor Corey. So I hope you join us for this exciting 3-day class that can change the way you practice implantology and finally allow you to provide the treatment that you would want provided for yourself, give you the confidence to handle every complication you are faced with, and be able to decide if I should treat it or remove it and start over, and most importantly, understand why this complication happened. So hope to see you soon. We are having multiple classes internationally and locally. We will have multiple classes in Chicago, LA area, Philadelphia, Seattle. We are also traveling internationally to Iraq, Jordan, Algeria, and Egypt. We hope we see you at one of our classes. Thank you so much.